What is the healthcare like in Sweden? If you are curious about what healthcare looks like in Sweden, you are in for some interesting information. Sweden has a universal healthcare system that covers all residents, regardless of nationality. This means everyone can access necessary medical services. Visitors from the European Union and European Economic Area, as well as countries with specific agreements, can also receive emergency care. The funding for this system primarily comes from local taxes collected by regional counties and municipalities. About 86% of healthcare expenses are covered by public funds. Only a small portion comes from private insurance or out-of-pocket payments. In Sweden, healthcare responsibilities are divided between regions and municipalities. The regions manage primary care, specialist care, psychiatric services, and hospitals. Municipalities focus on elder care, disability support, and rehabilitation services. The Ministry of Health and Social Affairs oversees the overall policies and regulations. When you become a resident, you automatically enroll in the healthcare system. You can choose your primary care provider from a list of accredited public or private options. One unique aspect of this system is that you can often see specialists without needing a referral from your primary care provider. This makes accessing specialized services much easier compared to many other countries. Public hospitals provide most of the acute care, but there are also private hospitals available. The services covered include inpatient and outpatient care, mental health services, dental care, long-term care, and prescription drugs. While most costs are covered, patients do pay small co-payments for doctor visits and hospital stays. For example, a doctor's consultation might cost between 8 and 25 euros, and hospital stays have daily fees that are capped after a certain period. Sweden's healthcare system is known for its high quality of care and strong patient satisfaction. Life expectancy is high, and avoidable mortality rates are low, which reflects effective health outcomes. However, there are challenges, such as workforce shortages and coordination issues due to fragmented digital infrastructure. For travelers visiting Sweden, it is advisable to have travel health insurance to cover any additional costs. If you are planning a longer stay, such as participating in a language immersion program in Stockholm, knowing about the healthcare system can be very helpful. Residents and long-term visitors have access to comprehensive healthcare services, which supports a healthy lifestyle that aligns well with Sweden's cultural emphasis on work-life balance and well-being. In summary, Sweden offers a well-organized healthcare system that is accessible and reliable for both residents and travelers.